went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
Adult trauma in 9 minutes. That's an adult trauma call in 9 minutes.
A traffic accident has taken place, and paramedics are on their way to King's with casualties.
What are we getting? Which one are we getting, the pedestrian or the motorcyclist?
The first to arrive is the motorcyclist involved in the collision.
Right, so we are getting the motorcyclist, but no doubt we will be getting the pedestrian. There we go, the pedestrian.
King's A&E resus system.
So you see, this is your training one, and then you can do the pedestrian.
Consultant Ema is in charge of resus today. She's been at King's for 9 years.
Yes.
Amongst the team are several junior doctors.
This is a motorbike who's hit a pedestrian in the tree at the same time.
Your ED job is the best job, but also the most stressful job you'll ever do as a junior doctor. The things you learn the best, that stick the best, are the things that you learnt in practice. And the books are fine, but it's not until you actually physically do it, the physical memory of doing it, the visual memory of doing it, that's what really makes it stick. It's the first of the 2 traumas. Let's get this one sorted then. Morning. Hang on, guys, our hands across.
1, 2, 3.
Because the patients don't have a label attached to them as they come in the door, we're starting with a blank canvas.
Okay.
Right, tell us the story.
He's hit a pedestrian and then hit a tree.
You start with a patient and a story and your stethoscope in your hands, and you try to work out what's happening. So James, talk to me. Do you see anything abnormal?
So there's equal chest expansion, but it's slightly reduced. The trachea is central. There's good air entry all over.
Are there any grazes, marks, bruises, anything on his chest wall?
Not that I can see, no. And there's a good resonant percussion note throughout as well.
Meng, will you request plain film of the pelvis, CT chest? James, you're going to cross-batch him for 4. Claire, you're going to ultrasound him. Yes. Thank you. Having 2 seriously ill or injured patients come through at the same time is demanding, because you want to be able to focus all your energy and all your attention onto the one, but you don't have the luxury of that. So you really have to trust your team.
The second patient from the collision is arriving at King's. He's the pedestrian who was hit by the motorcyclist.
This is the pedestrian, so this guy's going to get the full works as well. I've got to go because my other one's arrived. Bye.
He was witnessed to go head over heels while stationary and standing. Top to toe, he has an isolated laceration to the left side of his mouth. Neck's atraumatic, chest has bilateral chest expansion with a bilaterally tiered chest. Abdomen is tender on palpation bilaterally in the lower quadrants. He has lacerations to the left knee and to the left ankle. He has received 5 milligrams of IV morphine for the pain in both his abdomen and his legs.
Thanks, guys. Okay.
His abdomen is tender in the lower aspect with some voluntary guarding. The pulse is down here.
The pedestrian is suffering from a low level of consciousness and extreme abdominal pain.
Natural good pulses.
Both of the casualties are at King's College. We're struggling to find any ID on the pedestrian at the moment. He doesn't appear to have any belongings with him.
I'm just going to ring his wife.
You got his details with her?
I've got the wife's details.
When the accident happened, I was at home and I was getting ready to go out. And then basically the police knocked on the door.
Abdi, a 27-year-old father, was on his way to work when the accident happened.
It's showing a torch in your eyes, darling. Open your eyes for me. Sorry.
That was a bigger scare than actually going to the hospital and just seeing him. The police they just make your heart come out your chest. It's just scary when they come and knock.
Reduced level of consciousness at the scene, complaining of abdominal pain with a bit of abdominal guarding. But if we could do the top to toe, that'd be great, please.
Heart rate 75.
Can I please have a porter to resus for an urgent CT run? Thank you.
Good morning. I'm all right. Better than this gentleman.
I'm just waiting for the scanner to be ready. We're going to pop you through a scanner to make sure there's nothing that we need to do.
Abdi is being rushed for an emergency CT scan to determine whether he suffered any major injuries.
You expect the worst and kind of brace yourself for it.
Why is this shut? Come on. $22. Now, where was that?
So if you get your head nice and still for me, what we're going to do is you're on a board at the moment. We're going to move you across on that onto a different table, OK?
Over this side.
27-year-old Abdi is having an emergency CT scan after being hit by a motorcyclist on his way to work.
Where's your pain?
Of course I can.
I met Abdi on holiday. I met him on my last 2 days of my holiday. My first impressions of Abdi, they were good. He was a shy person, very quiet. After a while, he was lovely. He was really nice. I thought, I found a good guy. When Abdi found out I was pregnant, he was so happy. He was really, really, really happy. When the accident happened, Jabril was 2.5 months. He was really small. He was 2.5 months. So we was married for a bit. Where he had the accident, quite a few people have had accidents there. It's a really busy road, and you always see like flowers just on a lamppost, and it was scary, especially when they told me where it was. So I was like, whoa.
OK, on slide, ready, steady, slide.
You all right?
Hello.
Hello.
Hi, I'm Laura, one of the nurses. Hiya. Hello, Dad.
25-year-old Sarah has learning difficulties. She's been brought into King's by her grandfather and mother after collapsing whilst out.
All right, mate. Nanny can't come in, darling, at the moment, love. All right. Come on now, it's a good
Oh, hello, darling. What's the tears for? Oh, Danny. Oh.
Nan's outside.
Well, look, you've got your mummy here. Eh? And you've got your granddad. That's great, isn't it?
We went to pick her up from home to go to Orpington, do a bit of shopping.
Do you know where you are? Yeah, you are. Casualty.
We got to Orpington and she could hardly stand. I said, there's something not right here. And I rushed it straight down to King's.
Should we find out what's made you come to hospital today?
Yeah, my legs.
Your legs? What happened to your legs?
Can't walk properly, could you?
Can't work properly.
No, were you wobbly?
Yeah.
Wibbly wobbly on your feet?
Yeah.
Yeah.
Sarah's learning difficulties are the result of an inherited genetic disorder.
It all started with the right eye protruding. They put her through a scan and discovered that the tumour was pushing the eye out. And she had patches like birthmarks over her body, quite big ones, which is a disease called neurofibromatosis.
What's she normally like, as in day-to-day, the dribbling a new thing?
No, well, I've never seen that before.
So that's a new thing,
That's a new
yes?
thing, yeah.
OK, what's her mobility normally like? Is she mobile?
Yeah.
She was mobile, but obviously we have to watch her steps because her eyesight's not 100%.
Yeah, with the optical.
Yeah.
And is she normally like, it's her own food?
She started having chemo, and that started shrinking the tumour. There was a build-up of fluid around the brain. And they couldn't operate on her because her brain was still growing. She was only 3 years old. We were devastated. We were absolutely devastated.
Right, I'm going to have a chat with the doctors and see if we can find out what made your legs go wobbly this morning. This is another girl called Laura. Hello. Hello. So she's another one of the nurses like me. So if you need someone, just shout Laura and you'll get one of her. OK? All right. All right.
Number 5, trolley, to be scrapped. Number 5 trolley, the base.
Coming away.
Yes, where it's got a crack
Yeah,
right there.
yeah.
And the trolley's, it can't get apart.
Too old.
Resus. Yes, you can speak to me. I'm the major trauma consultant.
Abdi is on his way back to resus after having a scan.
Yep.
Doctors are reviewing his results to determine the extent of any internal injuries.
Yep.
I just need to get some details from you. You're not in any trouble or anything. But what do you remember?
I do remember seeing her breathe.
So then you've done that, and then do you remember, did it all go black, or do you remember anything after that?
Every day in the ED is different. We get 400 patients a day. I think you have to be conscious that you're probably part of the most stressful day of that person's life. It's just a normal day at work for us, but that is almost certainly one of the worst days of their life. And you have to respect that, and you have to allow them to feel that you really care, because you do.
So it doesn't look like there's anything serious going on, OK? Chest is fine, tummy looks fine, everything, all the important stuff looks fine, OK?
You're nice and still. Just nice and still. Nice and still for the minute.
Abdi's scan has come back clear. He'll recover in King's before returning home.
And the other way?
Is he going to CDU? Yeah, he will. Let me take some of these off. So we're going to move you to our CDU, which is like a little ward off the side of A&E. Just keep an eye on you a bit longer before they send you home. Do you have any children?
Yeah, one little baby.
They're gorgeous. Boy or girl?
A little boy.
And what did you call them?
Jibber.
You warm enough?
Yeah.
All right.
You just have to take care in general, especially when you have children.
Just take it easy, because sometimes you feel a bit sick after you've been through something like this.
Can't just run across the road, it's dangerous. You might be looking, but you never know, the driver might not be taking as much care as you. So always be very careful. That's what I would say.
"45-year-old Andy has come in with stomach cramps. He had a liver transplant 10 years ago.
You're up.
Okay.
So listen, I had a chat to the liver transplant team, and she's really keen to get an ultrasound today, okay, just to make absolutely certain that there's nothing kind of new to clear itself. So I've been up the stairs and organised that. They're ready to see you now. Okay. Do you have any questions so far?
No, it's all pretty standard. I mean, I've been coming here and, you know, for so many years now, I know it all.
Okay.
You know what I mean? I know my body pretty well now.
Okay, no problem. I'll arrange that.
All right, thanks a lot.
I had a liver transplant. It was a bit of a change. Once you have someone else's part of their body in you, has got a memory, what likes and dislikes that person who had it before. You might hate chocolate, for argument's sake, and then the person who you got the liver off is a chocoholic, and suddenly you find yourself eating bars of chocolate without knowing why.
Hello, sir.
All right, mate.
We'll be taking you up for your scan in a moment, sir.
Yeah, don't have to call me sir.
Sorry, full sir. What's your name, mate?
Andy.
Andy.
In my case, it was more, I don't like hot food. I don't like very, very spicy food. Because the person that I got the liver off obviously did like lots of very spicy food, I found myself like going to we'd go to a Chinese restaurant and I'd order like this really mad spicy stuff. And then I'd end up not eating half of it because I didn't like it. But it was like I didn't know why I was ordering it. So that's quite strange about having a transplant.
You usually have a bit of a wait up there, Andy, so
Yeah.
maybe up there a little while.
I've been quite a few times.
You know the score, mate, yeah.
I was brought up in the East End, sort of Dagenham area. My mum didn't have any money, so, you know, we were quite poor, I'd say.
Due to his liver transplant, Andy's stomach pains have to be closely monitored. He's being taken for an ultrasound.
Quite a strange childhood I had, I'd say. I mean, I met my dad for the first time when I was 30, which is quite, you know, quite late to meet your dad. You can't miss what you've never had. Like, I mean, I went to a psychologist, and he said, "How do you feel about it?" And I said, "Well, what is there to feel about? If I've never had a dad, then I don't know any different."
Sarah's genetic condition requires a permanent tube in her head, which drains excess fluid from her brain.
I like taking her over the park. She likes going out. I think when I used to take her to football, we used to have dinner out. She used to like that.
That is a special light for when we need to look closely at things and it turns on. Shall I show you?
Yeah.
Yeah, wow. Hey, see, look. Whoa. Wow. It's like a spaceship, isn't it?
She likes the football, the first half. Then she wants to go home. But I try to tell her, no, there's the second half. And in the second half, every 10 minutes, is it nearly finished? Is it nearly finished? Oh, dear. And unfortunately, football's an hour and a half.
Child are playing. I wonder how they're getting on. Hey? I wonder how they're getting on. Do you think they're going to win?
Yeah.
How many goals?
4-4-4.
4-4-4.
She's got a sense of humour. She's got personality, and that goes a long way. Hey? You okay?
Doctors are concerned that Sarah's collapse has been caused by a blockage in the tube in her brain.
Yes.
You sure you're all right?
Yes.
You're not, are you?
I want Granddad. I want Granddad.
You sure you're okay?
Yes, Granddad.
You're not, are you?
I want Granddad.
Yeah?
You can Granddad.
Hey?
Granddad.
Hang on a minute, love. Sorry, buddy. I think something wrong with she's slurring again.
You all right, sir?
Yes.
How's things?
All right.
No, she's look at her face.
Can you do that for me?
Look.
No, it's all right. I'm gonna get her in the scanner. We're just gonna go to the CT scanner. I'll take all them pictures just inside your head to see what's going on with that shunt. Is that okay?
Yep.
Yeah? So let's go.
Right.
All right, then?
Sarah's neurological symptoms are getting worse. She's being sent for an urgent CT scan of her head.
She was about 7 years old, I think, when her dad died. It was devastating for my daughter. You know, it was really bad.
They checked me out, and then they checked my husband out and found out my husband had the same condition as what Sarah had. But he was a very good dad and husband, and I miss him. Even though it's been 17 years, I still miss him, and it's hard. It will always be Sarah that keeps me going. And if I'm a bit low, she's always there for me. Sarah's my life. Without Sarah, nothing.
Back we go. Back to see Grandma and Mam. Is it Nan or Grandma?
Granddad.
Well, I know he's Granddad. I didn't think he was
My
Grandma.
Granddad. My Granddad.
Sarah's being returned to resus after her scan. Results show there's no blockage in the tube removing fluid from her brain. Doctors are now concerned that she's suffered a stroke.
They've scanned her head. They've also x-rayed her chest and x-rayed her stomach. So that gives the whole of where the shunt goes down.
I live day by day because we don't know what the future brings. So I just live from day to day. If we get through one day, it's a bonus.
Mum, how about dinner?
I don't know, Sarah, what's happening yet, do we? I'll get you some crisps.
No, Mum.
I can't have now because I don't know what's happening, do we? As soon as we know what's happening, then I know. All right? Yes, Mum. So you can't be down for long when Sarah's around because she's got a nice personality. She makes you laugh. She comes out with some funny things. She gives you cuddles. She's always saying she loves me. So it's Sarah that keeps me going.
Sarah needs further observation. She'll be admitted to the neurological ward to be closely monitored.
Yeah, but everything's fine, so the neurosurgical doctor will just get back to me. And hopefully there is a bed if she needs to stay in. There is a neurosurgical bed here, but hopefully they won't keep her in unnecessarily. We won't do that, so don't worry about that.
Take it one step at a time.
It's always good to think ahead, mind you.
Yes, true.
Okie-doke.
I'm calm on the exterior, but I'm tearing up inside, believe you me, but I can't show it. Sarah looks support all the time, you know, you've got to try and convince her that, you know, everything's going fine, and, which it was, you know.
Hello, we're going to be taking this lovely young lady to CDU. Eh? I'll wipe those tears away.
It's a very difficult role you have, though.
Yeah, it is. That, someone's got to do it. Someone's got to do it.
Look at that, you did super though, didn't you? Eh? You did, you're such a brave girl. So this is all where we work. All of us running around like little rabbits.
Okay.
Yeah, he seems to know where he's going.
Andy is back from his ultrasound.
Okay, you're going to be put in ADU, okay, mate?
Right, what's that?
It's just up here.
Actually deficient. Anyway,
Okay.
there's someone in there.
Yeah, it's all right.
Oh, right, okay.
Okay, take care and all the best and look after yourself.
Yeah, and you, mate.
I was a bit of a punk rocker in my day, fully immersed in all that in the middle of town, living in a squat in Camberwell Buildings in Waterloo with punks, skinheads, all sorts of people. So it was a good place to be. The sort of belonging, if you like.
Oh, no. I'm Navy man. I was in the Navy.
But then I did something really stupid and went and joined the Navy.
I've been to Cyprus a couple of times, been to Panama. I used to be on the Illustrious, HMS Illustrious.
I just sort of went, oh yeah, I'll do it, that'll be a laugh. You know what I mean? 5 years later, it wasn't such a laugh.
Oh dear.
It was fun, but not something I would sort of recommend if you've just got out of school or something, and then you go and put another 5 years of someone telling you what to do.
The Navy uniform used to attract the women better than the soldiers' uniform, that's for sure. You know what I mean? Unless, of course, you're an officer, and they like the officers. I remember we used to have to do diving in, going over the side, and then they'd lower, you know, the old rigging ropes. You'd have to climb all the way up the side of the ship to get back in. Oh, sod that. That was cold. It taught me how to be a man, I'll give it that. You know what I mean?
S goes round. That's how
Okay.
it's insurance.
So this is a hemorrhagic stroke, you say? Would you put a label on it? Okay.
Dr. Sammy has just started her shift. It's her 24th birthday today.
People do look at me, and I'm blonde, and I'm young, and I've got a pink set. I don't know why I have a pink stethoscope. It seemed like a really good idea.
Kings. Yep.
You definitely really need to get stuck in when there's a big trauma. It's really scary, and everyone around you is so calm.
1, 2, 3. Lovely. Okay, thanks very much.
Okay, nice and quiet for handover, please. He's been sedated with a total of 200 mics of fentanyl, 7 milligrams of midazolam, and has been stable throughout transfer until 5 minutes ago when he blew a pupil on the right-hand side, but it's blown again. Any questions?
That's good, thank you very much.
As Sammy is a junior doctor, when a trauma comes in, she's mentored by her seniors.
You can't be shy. You can't be, because these are A&E doctors. You need to become one of them, and sometimes it is a case of just getting in there.
Okay, from the top, please, guys.
Okay, trachea is central. And the more you do that, the more respect the consultants have for you, and the more you learn, the better you become.
Happy, Sammy, not happy?
Not sure.
Okay, Sammy, right wrist is free if that's blown. You can come back to the right wrist.
Yeah?
Would you be happy to put anything through that line?
We'll see.
No. Okay, well, it looks a bit blown.
I think people think I'm a bit strange for loving trauma because it can be very gory. But in those few minutes that you've got with them, you could save their life.
Just get a good line here and get that one out. We don't need that great. Sammy, just bring it.
No, it's in. It's definitely in.
Okay, that's fine.
But this one's in.
Okay, well done, Sammy.
That's all right.
Okay, good to go? Oh, you're welcome to come see to us if you want. Yeah, we're good, thanks.
Just gonna
can't find that bit with the puzzles. Do you know where it is normally? I can't. Because you could sit and have a look at the rest of it, and I can do that then, you see.
Bill has been brought to King's by his stepdaughter Jo.
Right, there you go.
His leg has swollen and he's having difficulty breathing.
When I first met Dad, he came into the family. He liked going to the beach and things like that, and I got on pretty well with him. In those days, I called him Bilko before Mum and Dad married.
She said to me on our day of our wedding, she said, "I'm not going to call you Bilko anymore. I'm going to call you Dad." And she has, ever since.
He's been my stepdad since I was age 6. He's pretty much brought me up. He's currently 91. Most people really don't think he's that old. They're really surprised.
I mean, nobody can look very young at 91, but apparently I appear that way, and I got a smooth skin. I used to do a lot of walking. I used to go out for a walk, and I walked miles. I've lost myself several times. I've had to say, "Excuse me, where's Peckham High Road, please?"
Mr. Baker? Hi, my name's Sammy. I'm one of the A&E doctors. Did you want to come with me? We've got a cubicle for you.
Ah, that's great.
Okay.
Yeah? Come on, then. Are you going to be all right?
Yeah. No.
Come with me, then.
What I did? My wife died a year ago, so...
Oh, I'm sorry. Oh, that's really sad.
We married in '67, when Jo was 6. She died 2 years ago. She was kind. She put up with me. She just attracted me. I don't know what it was. It wasn't sexually or anything like that. It was Eve and I was Bill.
Put one foot on and that'll stabilise it. Happy? And your other one. I got you. Oop, that's it. Oh! That's it. There we go. Right. Hang on 2 seconds.
Do you remember how you proposed to Eve?
I didn't get down on one knee. We used to have a particular sofa that I used to sleep on sometimes. And believe it, I used to sleep alone. There was none of that with Eve. No way. I tried, don't worry, but no way. I said, why can't we sleep together? So she said, we're not married. Oh, why does it matter whether we're married or not? I said, I'll sleep with women without being married to them. So she said, not unless we get married. I said, all right, we'll get married. So we set a date and that was it. Got married. Oh, my daughter.
Do you want to sit up a bit more?
No, get my breath back.
Yeah, okay. Get your breath back. Right, I'll let you get your breath back and I'll come and see you in a minute, Mo. All right, my love.
Tim?
Yeah.
I've got curry. I've got chicken curry and chips for you. Chicken curry and rice for me. So if you want some of mine, use that mat.
Right.
That's well nice. Want some of this rice?
No, I'm all right, baby, thank you.
Hope you don't stink this room out with our curry. Here's a no-carb diet out the window. You do make me laugh.
So, had a really useful chat with the liver transplant registrar. That your ultrasound's pretty much normal. There's a tiny little blood clot in one of the veins there that she's not concerned about it.
Well, I'll get some sort of painkillers now.
Why don't I get you a little bit of, the buscopan you want, don't you?
Yeah,
so why don't
possible.
why don't we just add that? Is there a person that you can ring
Oh, my transplant coordinator. Yeah, I mean, there is, but I mean, why I would want to ring her, I don't know.
Only if things are not settling down. If you were to need earlier review, that's what she's suggesting you do.
Right,
if things don't settle down the next week.
She's like a force of nature, she is. Oh,
Right.
yeah, Scottish woman. You don't mess with her.
No. All right. Sounds fiery. So let me get that buscal pen.
OK, lovely.
And then we'll get you on your way, so...
I am very much happy-go-lucky. I've had quite a few things sort of happen to me in my life. Like I had a liver transplant. I've had pneumonia in foreign countries and been on a life support in Abu Dhabi for like a month or something, 2 weeks, something like that. So, you know, I've had a lot of things happen. The thing that I've always thought is there's no point sitting and moping about it. So, you know, it's better to have a laugh and just sort of get on with it, and then, you know, what happens, happens.
OK, then. All the best. Take care.
Yeah, and you, mate. Speak to you later.
Hello. Sorry that took me so long. Right, so I've been told a little bit about you.
Oh, good.
Tell me in your own words, what's brought you in? Oh, my goodness.
His legs...
Look at the size of that.
I know. It's basically overnight. It's swelled up above the knee suddenly. Dad's been treated for prostate cancer.
Right, OK.
And he did have... His breathing's getting worse, and he did have evidence on his liver and lungs.
Right.
But it had gone into recession. I'm just wondering whether there is any connection.
Maybe. Do you normally wheeze?
No, not normally.
So this is new, is it? This wheezing is new?
It's fairly new, in the last few weeks, really. You get breathless just coming down to the kitchen for your supper.
Exactly. Yeah, no, I know.
Although he has still been persisting with going out for his paper in the mornings.
I go for
Man needs his paper.
It's not all that far.
Well, it's a quite...
About a mile each way.
No,
how
it's not
much?
as much as that, no. It's about 300 metres each way.
It's pretty good going.
It is pretty good going.
Take it easy, though. Right, nice deep breaths in for me. You shouldn't have favourites, you really shouldn't, but sometimes you just can't help it, and there are people that you instantly warm to. And it can be, like in his case, that he did remind me of my own granddad. Fine. What I am worried about is that you have a clot in your leg. Now, you're at high risk of getting a clot because you've got the prostate cancer, which makes your blood thicker. Now, the problem is when you get a clot in the leg is that it can travel up to the lung, and then you can get very breathless. So when your daughter says it might all be related, it could well be. So that's my sort of clinical feeling on it, that there might be a clot in the leg. So we'll send you off for a scan, I think, have a look at that leg. I'm going to x-ray your chest as well, see if we can see any reason for your wheezing and give you something for your tummy. It does happen quite a lot. Someone's come in with a pain or a random symptom and we've done a scan and found something that we were never expecting to find. And I don't think anyone will believe how common it is. It happens all of the time.
Hello, darling. Hello. Hello.
3-year-old Emily is suffering from stomach pains and a fever.
Have you ever had any experience with helping us take blood from children? So essentially you hold it very nice.
I might have to walk out of the room. I'll get really upset seeing anyone touching my daughter, so...
Absolutely.
Doctors suspect she may have appendicitis and want to carry out blood tests.
Are you sure you want to be in here for this? Or do you want to stay?
She will scream.
I don't know, it's not fair on you, though.
I'm all right.
I'm not going to come in here. Sorry, I'll get really wound up. I'm really upset about that. I'm really
If you
sorry.
could wait, where you were before, then we'll sort this
It's
out.
not about... Hello, princess. It's all right, darling. Look, what can we look at? Oh, look, Simpsons on the ceiling.
You have been the bravest little girl I have ever seen.
Wow.
She all right?
All fine.
Coming to a point with a 3-year-old's braver than the 29-year-old dad.
Yes, absolutely.
Put that on. It won't go any lower. We had to have a ladder before, but unless you can just about manage it. Oh, that's pretty good.
Bill has returned to Majors with his stepdaughter Jo. Junior Dr. Sammy is reviewing the scan of his lungs to check for any blood clots.
And up a bit, that way a bit.
Great, thank you very much. All right, bye. Mr. Baker, did the medical registrar have a chat to you about your scan results?
About my...
Scan results?
Yes.
So he told you there's no clot in the leg?
There's plenty of water.
Plenty of water, OK. Gosh, you are still very wheezy, aren't you? Telling people bad news is always really hard. It is hard for someone like me, and I'm not used to doing that.
Did you see anything?
Yeah, we did.
What?
Well, we're not quite sure, but there's a bit of... Looks like there might be some nodules there.
Nodules?
Nodules.
Attached to the lungs?
On the lungs.
I see, yeah.
At some point, we need to do a CT scan of the chest to see whether it's the cancer and whether it's spread. OK. So, I'm sorry to tell you that news.
No, it's all right.
Really?
Yeah, you get to 91, you couldn't get less, could you?
OK.
No, don't worry about that. I'm not the worrying sort of.
Yeah.
How old are you?
I'm 24.
Cool, I remember when I was 24.
Mm.
I don't feel 90. My imagination of 90 was wrinkled and can't move type of thing, you know, and I'm not one of those. You don't want to worry for me. You got your life ahead of you.
Oh, but I will worry.
No, you won't.
Do you know what? It's my birthday party tonight and I'm still going to be worrying.
I thought, well, everybody died after about 70. There you are. I've reached them past it.
Lovely to meet you.
Bye-bye, dear.
Bye, my darling.
Lovely talking to you.
Yeah, you too.
It just comes and goes. As you reach 91 or 92, it doesn't worry you too much. It doesn't worry me. I've had a nice life with nice people. Generally, anyway.
Oh, I was in such a good mood when I started. Now I feel absolutely rubbish. So sometimes things, you know, we're all human. We're not robots. And sometimes perhaps we can seem like that. But we do this job because we care about people and we want to look after people. We do this job because we want to help people. So, you know, we do care. And sometimes it can get a little bit too much.
She's 24 today. She says she's going home to a birthday party. The little nurse.
Oh, right.
The pretty little one.
Right. She's not a nurse, she's doctor.
The doctor.
Yes.
She's nice.
Yes.
And,
Oh, it's her birthday.
yeah.
Yes, no, I'm very proud of her. Since she was 3 years old, in 22 years, what she's had to put up with. And she keeps bouncing back. And she's always got a smile on her face. no matter what. That says it all, doesn't it?
You take the good with the bad. You know, you never get good and only good. For every one good moment, you probably get 3 or 4 bad ones. So, you know, you have to try and make the good ones memorable. That's the way I look at it. At least you can say I lived. You're only here once, so, you know, go for it. And, like, you know, if it all goes wrong, so be it. You know, c'est la vie.
I'm very happy to be here and to be alongside her. Proudest moment being a father to Joe. Oh yes.